Welcome to Porchlight, a presentation of Porchlight VNA and home care, providing first-rate, highly personalized care to the Berkshires and beyond in Hampton and Hampshire counties, all in the comfort of your own home. And they say in healthcare that an ounce of prevention is worth a pound of the cure, and nowhere is that more relevant when it comes to falls prevention, especially for senior citizens. And I'm very happy to welcome to the program two people who are very involved in an excellent program that Porchlight VNA has, and it's kind of a traveling show. Lynn Proulx, who is here, she is the Supervisor of Rehabilitation Services for Porchlight, and Anna Chapman, who is the Director of Clinical Operations for Porchlight. And the two of you, welcome to the show. It's great to have you.
Great to be here.
So falls prevention, to me, is something in senior care that we talk about quite a bit, because statistically, and I know Anna has the statistics, is that if we can make sure that people are following proper techniques, we can avoid a lot of things like broken hips and other kinds of things that cause major issues. So, so this is a great program. So Anna, tell me a little bit about how this all began, this falls prevention program that you have.
Sure. So we were talking to different clients and patients and people in the community about, falls, and Medicare is actually having a hard push for fall prevention, because that's the biggest cost to them. Over billions of dollars a year are spent because of falls, and then they end up going to skilled nursing facilities and sometimes never come out of those skilled nursing facilities. So we had talked about what can we do to try to set up a program to do that before the falls happen. And we happened to be going through information and found where Cooley Dick had been working with Tufts Health Plans Foundation and had created this program, and I contacted them, and Lynn and I met with their person John there, and we developed the program with the use of them.
And this is Cooley Dickinson Hospital.
Cooley Dickinson Hospital, yes. In Northampton, and Tufts Health Plan, yes. So that's how we got the basis for that, and then we started to create this, and then we had to find funding, of course. So we approached Elder Service for grant funding that they have every year, and they were very interested in falls prevention also. And then also our local Tri-Town for Lee, Lenox, and Stockbridge was interested in supporting us. So, and then, of course, Porchlight VNA does their portion also. And that's how it all started. And then we had to find our audience. So the audience is usually ALFs, senior centers, council on agings. We contact them. We can go to rest homes, any venue where we can have a public sort of meeting and gathering. The only places we don't do is where they have acute rehab already, like skilled nursing facilities, because they're already offering that. So we started this about 3 years ago, and we've probably done close to 20 of these fall prevention classes.
And that's a lot, because this is a pretty extensive program. I believe it's 6 weeks.
Correct.
So doing 20 of those during the time, that you've been covering quite a bit of territory with that.
We have been. We've gone to North County, Adams, all the way down to Sandusfield and all the surrounding towns. So someone contacts us and says, I'm interested in you coming to meet with our senior citizens about falls class. We go out, we do an introductory, about an hour of what it would be consistent of. They have to agree to come for 6 weeks, because it builds on it each week. We offer new information, and we continue to build on our program. So it's a commitment on their part, and it's a commitment on Lynn and my part that we will be there and do this teaching with them.
And really the facts and figures to back this up, the investment in something like this really does pay itself back manyfold, I would assume, because the cost of falls is so dramatic. So to avoid that, that's important. So what are those statistics?
Okay, well, in the community, people over 65, and that's not really that old these days when you think of that, because there's a lot of work.
Very active over 65.
Right, over 65, still working. 35 to 40% of those 65 and older will have a fall in a year. So that's a pretty high number. Of those that fall, 50% of those in the hospital will end up in a skilled nursing facility. And out of that,
they usually never come home.
33% will
Yeah.
end up not coming home.
Yeah.
Right, which is a long-term cost
Correct.
To the healthcare system.
To the healthcare system, and ultimately, to our overall community that has to pay for it. So, and then enhancing the quality of life is so important for these individuals
Right.
because everyone wants to be home and everyone wants to be healthy, and avoiding those falls, those numbers tell a huge story. So, Lynn, from the rehabilitation side, you are an occupational therapist. That is your expertise, and so you go in with Anna for these presentations. What are some of the first things that you talk about to individuals who are taking this
Well, what we're talking
course?
about is, well, the first week is just general. We have them fill out a self-efficacy form. They're assessing what they think their balance skills are, and then we assess them as therapists on what their skills really are. I mean, some people say, I have no trouble, and I never, that wasn't a fall, I just kind of stumbled. And, once we put them through a standardized testing.
Do you find a big difference between what they
Yes.
think that their level is and what actually is the case?
Absolutely. They always rate themselves higher, and they are more apt to not want to use a device as a cane or a walker because they don't want to seem old. When with this device, they would have reduced their risk for falling 100-fold. So,
Which is interesting because I guess there's a combination, because one of the first things that you would run into is saying, well, I don't believe that I need a cane, or so on and so forth. But then there are also perhaps opportunities for people to gain strength in certain areas.
Correct.
So perhaps they won't have to have a cane in the
some of
future.
ours go from the walker to a cane. So we've actually improved their balance. So
Wow.
it's, our program has been very effective. What we do is on the second week, we do a series of testing, which are standardized tests, and then at the end of our 6 weeks, we schedule a 3-month follow-up. After 3 months, we come back and we do these same tests that we had done on week 2, and we compare the difference. And the people that continue our program have shown to improve their balance greatly. I mean, it's amazing how we make a difference in people's ability to stay upright and off the ground.
And as far as the program and the commitment, I mean, we're talking about, what, 1 hour per week?
1 hour per
so
week.
this isn't
Right.
this isn't a college course or something like that. It's a relatively small amount of time that people are investing, and the impact seems very significant.
And we base it on what their ability is also. That's what's nice. We can self-adjust the program. So if somebody shows up in a wheelchair and we know they're not going to be able to do certain standing balance activities, then we adjust it to that person. So they're still gaining from the program. So it's a very individualized.
Right, it is. I mean, everybody has their own pace, their own endurance, and we have shoulder injuries, we have back problems, and as therapists, we come in and we modify their programs so it's fit to them. So it's, like having a private session, except in a group, which is more productive. And a lot of our patients or our clients, when we do the class, they are asked to do this program at home. So they're building strength for the next time when we meet, because it's just going to continually get harder week after week. So they have homework. A lot of the people will meet and they exercise together, which then they form a social bond in a group, and it's just a wonderful thing.
And I would think that exercise in general, walking in general, and a lot of the things that are recommended for anyone, never mind senior citizens, probably are helpful. However, what are some of the more specific things that are included in this program that really can kind of get a lot of bang for your time and energy buck as far as balance? I mean, are there certain muscles you're focusing on?
Actually, it's a total body. The primary joints are the ankles, the knees, and the hips. We work on trunk stability because our trunk is, as you know, as we get older, we tend to flex forward, and we kind of start walking like this. So we're trying to teach people to keep their bodies upright. So we're doing head, neck, shoulders.
We can all do a better job of that.
That's true. Yes,
Sit up straight.
And the biggest thing is a lot of our participants sometimes are very fearful in the beginning because they are afraid of falling. They've had a fall, and so they hear about us and want to join our class so they can overcome that fear of falling. And it's you know, amazing when you see someone with confidence after 6 weeks strutting and here I am and let's go for it, you know, and just really successful.
So Anna, you probably, you see that progression
Correct.
through the 6 weeks.
It is, and each week we talk about something different too besides just the warm-up exercises and then our strengthening exercises and our balance exercises. We focus in on a topic. So one week it'll be vision and how that can affect you in falling. Another week it'll be medications. We talk about what their medications are. Somebody might have a question, I'm on this, could that cause this problem? How that might cause you to lose your balance. We talk about their balance ability with their feet if they're a diabetic, you know, how they can't just feel the floor underneath their feet. So each week is a different topic for about 15 minutes, and then we get into the full exercise part of it. So it's a, it's a very comprehensive program.
And it's educational because, like, we'll let them know next week we're going to talk about medications. Anybody want to bring their medication cards? Anna will help them say, okay, the combination of these two might cause increased dizziness, which might increase your risk for fall. And if they have glaucoma, now you're adding that they're on medication, they can't see all that well, they're at a higher risk for falling as opposed to the norm, us who, probably take a vitamin a day and, we don't have these issues. But as the population gets older, we have more and more difficulties with our health and, every little thing impairs your balance.
And looking at, for those who may be watching this program and may be interested, those who are eligible, and I know we go specifically to, these assisted living facilities or independent senior living facilities or the senior centers and that sort of thing. However, I think it's probably fair to say that people who may be either within those places or maybe in the community, if they're interested, I assume they'd want to contact Porchlight and understand how perhaps we can get one of those programs set up.
Correct.
That would make sense for perhaps their own community or what have you. So how does that process work?
So normally they'll call, and usually I will talk to them because Lynn's not there all the time, but if she is,
she's so busy.
She's so busy.
In the field,
she's in the
care of
field.
these people.
That's right.
Getting their balance better.
Whoever's available, we'll talk to them and tell them where the next program is, and can they get to that program, and if not, and it's in an area where we haven't gone yet, we can say, well, we can contact somebody at the Council of Aging, and we can go and have an introductory meeting and see if there's enough interest for people to come. We would like at least more than 5 because the interaction with each other is what helps also, because they're kind of talking to each other about things that have happened to them in the past, and then we can look at that all as a group and say, okay, let's work on that. So at least 5 people and not more than 20. Because we have to keep our eyes on people while we're doing these things, because we don't want them falling during our falls class.
Yeah, that wouldn't be good.
That would not be good.
And it has never happened.
That's right.
And would.
And a lot of facilities that we have gone to, the independent living facilities, they actually invite the community. So you are able, they put ads out. Sometimes you'll see them in the flyers, and it will say, we're having this class. Please, come out and join us in this feat.
Right.
So
then it makes sense because for those facilities, they're bringing people into their own building so people can experience the atmosphere and so on.
They have invited the community, and we have had, outsiders come, not just the people living in those.
Right. We're going to be offering one in Devonshire Estates pretty soon in Lennox. And we're going to be doing an introductory at Otis. You don't mind if I flip my paper for a second?
You go
I'm
right
sorry
ahead.
to make a little noise here, but on August 21st, the Otis Council on Aging from 1 to 2 will be there and talking about it and see if there's enough interest there. And then we'll be at Sugar Hill in August also.
Sugar Hill and Dalton.
Sugar Hill and Dalton, and that will be August 16th on a Friday, and that's from 2 to 3:30. So if there's an interest in the community, they can come to one of those also and hear what the program's about and sign on or see if we can go to an area that's closer to them.
That's fantastic. And looking at the overall program, Lynn, for Porchlight, we've spoken about this on the program several times, that sometimes when people think about visiting nurses, they think of someone who maybe sick in bed, and the nurse is coming in and taking care. And we certainly do that. There's no question about that. But sometimes they don't perhaps recognize the activity opportunity as far as rehabilitation. So there's a lot of post-operation type work that's done with Porchlight. And so people who are getting their knees done or hip surgery or that sort of thing and want to stay home for rehab, Porchlight is the option for that.
It absolutely is. We have an exceptional staff of rehab girls. We have physical therapy assistants. We have OTRs and speech pathologists who, whatever your need is, we will come to your home and give you the quality of care that you deserve. And we tend to be a little aggressive and motivating, so
it's interesting, whenever you speak to patients, they say that Porchlight has the perfect combination of sort of, that aggressive that you're talking about, element that you're talking about, and yet knowing where that line is. That's kind of the art of the skill, right?
That's correct, because we provide emotional support, definitely, and we know when enough is enough, but our patients really thrive on that. Let's get going, and you've just had your knee replaced. We're going to get you up and walking and back to enjoying life sooner, and hopefully everything works and
extra little push they need.
Yeah, and just by being very supportive to this, the patients, it's been a successful outcome for all of our patients.
And many of the great outcomes that we've had from Porchlight are, rehab type patients. And people may remember we had Joe Fergal on the program, who's very much a big fan of Porchlight, and perhaps they've seen some of those advertisements as well with him out there playing golf.
He's back in the swing of things.
He's back in the swing of things. And specifically, you did a lot of work with him.
We did.
And I think that's the message to people that, again, it's all about getting people back in the swing of things, but back on their feet, back to their daily lives.
Because a lot of people, I think, have the impression that because we're a home care agency, they have to stay home, and they do. Our goal is to get them back out to doing what they want. So you're home for a short little stint, and if you want to go back to being independent, we're not there to keep you there. We're there to give you the skills to get back with your life.
Yeah, that's important, and Anna, that's part of the comprehensive element that Porchlight has, because there's the VNA side, very clinical, and you're the head of the clinical operations. There's also the home care side, which is the non-clinical side, but still provides
supports
sort of that.
In the home.
Exactly. So. The vision for Porchlight, I mean, to me, it seems like over the last several years, a lot of the services that once you perhaps had to be within a facility to receive have now begun to almost a throwback to sort of the old doctor doing house calls.
That's right.
That's a reality.
That's right. To keep the patient in the home as long as possible, safe as possible, and happy, so that they're not out of their element, and feeling at loose ends when they're other places. It's just not like being home, And we roll all our programs together, so it's very comprehensive. Even the program we offer in the community, our Falls program, is part of our Falls program in the home. The concept of it. So if we get a call from a doctor saying, I've got a patient that's falling a lot, but they're homebound, we'll put physical therapy in there and just put that this is for the falls prevention program. And they will go out and work with them on falls prevention in the home. So it's easy to move any of our programs from one side to the next, and then continue it with the home care side of it. We have a family right now that we're doing restorative home health aid, which was the first time that we said we don't need to keep putting PT in all the time. We just need to work with that aid that's in there, which our PT did. And now
just so people know, you don't physical therapist.
A physical therapist, doesn't need to be in there, all the time. So the physical therapist went in, worked with the home health aid. Now they're doing restorative home health aid for this person 4 times a week. Perfect. Keep the patient at that optimal level of functioning.
And that's the whole key: quality of life, high level, and so on. So this is a passion clearly for both of you. Lynn, tell me a little bit about what brought you into the world of healthcare. You, as I said, your expertise is in the area of occupational therapy.
I am. I'm an occupational therapist. I have a psychology background, and I worked in the hospitals and nursing homes. And I remember years ago driving, and I always saw the Lee VNA sign, and I said, someday I'm going to try home care, and I'm going to work for that agency, never knowing that in a few years I would be on their doorstep applying for a position. And in the home, it is so different than being in a nursing home where you are grouped together in a gym. It's one-on-one, it's in your home, in your environment. So we're actually dealing with your life. Everybody's home is different. You may have scattered rugs, you may have 10 stairs, you may need, it's not a flat environment. Our world is not.
And yes, our friends in the long-term care side, they have their niche, and we certainly have ours with Porchlight. But interesting that you point out that Bob Smith may be having rehab, and yes, he has a long stairwell that he has to get out while other people may live in a ranch, that sort of thing.
Correct.
As opposed to perhaps being in a gym in a long-term care facility that has 3 steps and that's it.
Correct.
And grab bars everywhere. And no carpeting, and all the floors are flat.
Exactly, and so that's where where the niche of being able to rehab directly in the home is so valuable.
It's therapeutic. It really is for the patient to be home and recovering like that. And what we do, we go out, we do a home safety assessment. Do they need grab bars? Do they need, what kind of equipment do they need in their home so they can safely stay in their home, be as independent as they can. So we even do this if you are pending surgery, if you know you're going for a hip surgery, we will actually come out prior to your surgery and go through your home and make recommendations. So if there's anybody that is considering, is my house right? Do I have what I need? Don't ever hesitate to call, because our girls are professionals. They can go out and, come up with some ideas, make a list of recommendations, and, it's just a wonderful feature that we add to our agency to provide.
And Anna, you've been in healthcare for maybe a couple years.
Yeah, just a couple.
And so tell me about your evolution career-wise, what brought you into healthcare, and what ultimately brought you to the position of Director of Clinical Operations for Porchlight.
Okay. Actually, I was a rehab certified nurse, so I worked rehab for many years as a charge nurse there. So the transition to home care was natural, because I was always used to working one-on-one with patients and with therapists. So very used to the therapist lingo, and very used to what they want to perform and get from the patient, and their goals and how to reach them. So for me to come to home care was a natural transition. And actually, I went in as a manager of clinical services, started to learn that role because I had not done home care before, but it was a natural piece just coming from rehab, and just kind of worked myself up through the seasons to become the Director of Operations. But the background, I think, always goes back to the patients. What's the patient goal? That's our main thing that we're always working. What is your goal? Maybe they had a stroke, and maybe their grandson's getting married in the fall, and they want to be able to go to that. Right. Can we, as the group, therapeutic group, get them to that goal to be able to get to the grandson's wedding? And it may be baby steps, but it could be something that could be accomplished. So that's what we're always saying when we go out there. Yes, there's certain goals we have to reach in order for insurances to pay us, of course, but always in the back of your mind, what is the patient's goal? What do they want to get out of us being there in the home?
Right, and I think that approach is such a positive approach, because many times people have this impression of what healthcare is, and sometimes there's a negative impression because, who wants to be in a hospital, who wants to be in a nursing home, and so on and so forth. Nobody really, wants to be there unless they're having a baby. That's one thing. As far as that goes, but having that focus on something that is a goal ahead, something to achieve,
something to look forward to, something to achieve. Know that you've accomplished something. You've had a bad stroke, but you know what? Life goes on, and so can you. And let's see where we can get you. you know, something that just gets to the heart of everybody. I say to nurses that join us that have never done home care, come from the hospital or come from a skilled nursing facility, once you do home care nursing, VNA nursing, you'll never do any other nursing again. You just won't. The autonomy is there. You're out there working with the patient one-on-one. You're teaching. You're trying to get them back to be as independent as possible. Where else can you get that? You know?
And I think it's reflected, especially in our local community, as to the reputation of Porchlight VNA. You know, nothing but wonderful things you hear in the community about the work that you do, and it's all because of the great people and also a great level of customer service. The Porchlight staff members, they're happy. They're happy. And it makes a big difference. Okay, so as we have just a few seconds left, let's make sure people can get in touch and know what the contact information is for you, Anna, to learn more about the Falls Prevention Program.
So just call Porchlight VNA 243-1212 and ask for Anna Chapman. And if I'm not available, I do have voicemail, so you could leave that for me. Or if you really want to know if something's happening soon, you could also ask for Lynn Proulx. And if she's available, she can tell you. Either one of us is always around to be able to answer questions.
That's true.
That's true. Anna Chapman, a great pleasure
Nice
to have you on the program. And
you,
Lynn
John.
Proulx, thank you so much. Very
been a
informative.
pleasure.
Yes, it has been. It has been. Thank you very much. And this has been Porchlight, a presentation of Porchlight VNA and Home Care. I'm John Krol. Enjoy your day.